This video will show you how to clean your All-On-4 bridge. So with the soft manual toothbrush, you just want to load a pea-size amount of the recommended toothpaste, holding it with a pen grip, and you just want to go around to gently brush along the teeth and the gum line to disperse the toothpaste and disrupt any big food particles. Here's the Implant Ortho Brush. This is a long, thin, streamlined brush made for you to brush along the outside facing surfaces, right along the gum line where the bridge and the gums meet. Best way to access is to bite down together so that your lips and cheeks are nice and relaxed and you can fit the width of the brush right in there. Similarly, you want to go around with a gentle circular brushing motion just to massage the gum line and remove any food particles. Here's a universal care brush. So with the universal care brush, it's made for you to access the inside arch of the top and bottom bridge. You want to direct that brush bristle right along the gum line and go along in a gentle circular brushing motion. This is the compact Tuft Brush. The compact tufted brush is like a refining brush. It's good for those tight areas, so in between the teeth, right where you can see your implants, or behind the bridge. Really, you can use it anywhere. This is the X-floss. We've got both blue and green, and they help to identify the sizes. So with the X-floss, we recommend for you to bend the tip for better ease of use. Now, best way to get in is to bite down so that your cheeks are relaxed and feed that floss through all the way and pulling it through to the fluffy part. Adapt the floss towards the bridge, forming a U shape. For the bottom teeth, that U shape is pointing upwards and the top teeth U shape is pointing downwards. Once adapted, shimmy that floss along nice and slowly, back and forward a couple of times to remove the debris. Once you feel the implant, adapt the floss C shape towards the same direction and shimmy that floss up and down the length of the implant nice and gently. And then shimmy towards the other side and adapt the floss and up and down the length of the implant nice and gently. So, a hot tip, if you struggle to get the floss through on the top bridge, you can try inserting from the inside where the hard palate is located. Tissues there are a little bit thicker, so it's a little bit more comfortable when feeding the floss through. Lastly, once you're done with the flossing, make sure you hook the floss behind the bridge and continue with your C and U shape adaptation. For the pixer brushes, they come in various sizes and colours. Your dental practitioner will advise you which one would suit you best. So we recommend for you to pop the cap on the back for better grip and to bend the tip of the Pikster 90 degrees for ease of access. Similarly to flossing, we advise you to bite down so that your lips and cheeks are nice and relaxed and you can fit the Pikster in without it getting caught. Gently push the Pikster brush in up against the implant and up against the bridge, gently walking the brush in and out until you reach the other side. If the Pikster brush is tight, don't worry about forcing it in, just move on to the next accessible area. Lastly, we recommend to go around with the water flosser to finish off your oral hygiene regime. Firstly, attach the classic jet tip as shown on the model. Fill up the water tank with lukewarm water. To turn on the machine, press both of the buttons as shown here. To adjust the water pressure, use the dial on the side. We usually recommend starting from 1 to 4 and slowly working your way up. So get the tip of the water flosser nice and close towards the gum line where the bridge and the gums meet. Get the water going and go along the gums with a back and forward, in and out, and circular motion to flush away any food or debris. Thanks for watching the video. If you have any questions, feel free to contact us.